You look good. Good afternoon, good evening, good morning, depending on where you are, where you're watching this live. This is the voice and the face of Dr. Olabintan, CEO, founder of Livingspring Family Medical Center here in the good city of Mansfield, Texas. And I'm excited to be here to discuss another live with you, all in the name of helping patients live long and well, because we believe the quality of life is just as important as the quantity of life. I am happy to have a friend and a physician here to discuss the topic. Doc, I have a weird rash on my face. Is this lupus? And I'm talking this evening with the one and the only Dr. Celine Lee. She is a rheumatologist based out in Utah. Thank you so much for coming. So glad to have you here. I know you're busy. Thank you so much for coming.
Well, thank you so much for inviting me.
All right, my pleasure, my pleasure. Now, I know I already introduced your name, but if you don't mind, for our viewers who are watching hashtag live, for those who are watching live, and those who are watching hashtag replay, can you kindly introduce yourself? What do you do?
Hi, my name is Dr. Celine Lee. I'm a board certified rheumatologist, internist, dermatologist, and lifestyle medicine specialist. And I work in Murray, Utah, which is a city near Salt Lake City.
Awesome, awesome. Now, inquiring minds want to know, why do you do what you do? How did you come about rheumatology?
We started way back when I was still a dermatologist. I've been always interested in finding the root cause of medical problems because without addressing the root, the hidden root of the problem,
Right.
all the problem will just keep coming back. So when I was originally a dermatologist working in South Korea, I saw a lot of skin rashes. There was just just surface symptom of a deeper internal medical problems. So people just come to see me because they have skin diseases, but actually that's a just a 1% of problem that they have bigger problem inside. And one
Mm,
time I even discovered a rare condition that can develop into colon cancer when a patient just came to see me just for what he thought it was just acne. But it was actually symptom of the colon cancer that was developing in
wow.
his colon. And it was discovered by me because he presented and he had subtle symptoms that was pointing that it's just not just acne, it's something else. But this is a rare thing. It's going with cancer, but most of the time, the more common thing was that the skin, a lot of skin problems can be associated with rheumatology disorder, and I saw a lot of those. And I was kind of disappointed because once I discovered the rheumatology problem, I had to refer to a rheumatologist, and I could
Right.
not take care of that root cause problem. So I decided to study rheumatology more in the United States. So I came here, did another residency training in internal medicine in Philadelphia, and I finished my rheumatology fellowship at UCLA, and I've been
Mm.
working as a rheumatologist since.
Awesome, awesome. I'm glad. Root cause analysis. You like to find, what's the problem from the inside out. I like that. Not the outside in, the inside out. All
Mhm.
right. So great. My first question is this. So it's in here, doc. I have a red rash on my cheeks. I Googled it and it said lupus was a possibility. What is lupus? Simply put, doc.
So lupus, many people know lupus by its famous butterfly rash because there's rash in the cheek like this, like a butterfly. But it is actually not a skin
Hmm.
disorder, it's a systemic disease. So, simply put, it is a disease where our immune systems, let's say, like kind of a defense radar system, if you will, is malfunctioning and mistakenly recognize our own tissue as an enemy to attack. So, in lupus, our own immune system end up attacking ourselves. So, this is kind of definition of autoimmune disorder, and lupus is one of the common one. So if it attacks the skin, it causes lupus rash. If it attacks the kidney, it causes lupus nephritis, which is a condition where kidneys get damaged by our own immune cells. You've probably heard, it was quite famous that Selena Gomez has been very open in talking about her lupus and how she had to have kidney transplant because she had lupus nephritis. It can also attack our other organs, such as it can lower our blood cells and cause anemia, low white blood cell counts, and low platelet counts, and also attack the joints and cause joint pain and swelling and stiffness.
Wow. Thank you very much for breaking that down. Lupus can attack a lot of organs. Essentially, it's a type of autoimmune disease where your body attacks itself. Now, people are wondering what causes it. You alluded to it, but can we talk a little bit more about that? Like why?
So genetics play a lot of role in lupus, and it is known that certain ethnic groups tend to have more of it, but it can actually occur in any ethnic group.
Okay.
For example, it is known that Hispanic Americans and African Americans can have more lupus, and the severity can be more severe as well. But
Okay.
it has been seen in Caucasian, Asians, Native Americans. It can be seen in anybody, and I see all of these patients from different groups. And a lot of lupus patients usually have some family history somewhere in their family tree, but
Mm,
some lupus patients develop the disease even though they don't have anybody who has lupus in the family.
okay. So genetics can play a part in it. Now, you were talking about the rash, and I remember that you do have pictures. Is it okay if we share those?
Yes,
All right. So I'm going to add that to stream. Can you see my screen?
yes. Hmm.
Okay.
Yeah, so I kind of wanted to tell you that a lot of people are so worried when they have some rash in the cheeks. They're, oh my God, is this lupus? And, Google it and you see all these like kidney transplant and, horror stories. And then they're really, really worried. And I get a lot of referrals because of those. But I want to tell you that not every rash in the cheeks or lupus rashes. And
Mm,
actually, there are, really, really common things like really excessive sunburn. You are out in the sun all day and
mm,
hiking. You did not put on sunscreen and you're sweating a lot. Then you can have some, red rosy,
redness.
yes, and some contact dermatitis from cosmetic products you could be allergic to. The contact dermatitis can also cause rash on the cheeks. And among the skin diseases, the most common skin diseases, that is confused with lupus rash is actually rosacea. And
Okay.
rosacea is really, really common, especially in middle-aged women, and
Okay.
have some similar, aspect like lupus rash. And you can see in this picture, they both rash on the cheek. But there are some differences between lupus rash and the rosacea. I don't know if you can see in the picture that the lupus rash picture, you can see the line between the side of the nose to the angle of the mouth, like this line here. This
Mm-hmm.
is called nasolabial fold. And
Mm-hmm.
lupus rash, the butterfly rash of lupus does not involve this line, this
Ah.
nasolabial fold. And this is one of the things that we look at when we try to differentiate between lupus rash from rosacea. And also rosacea tend to have a little bit more of like acne-like breakouts, such as you'll see a little bit of raised bump. Sometimes it can be filled with pus. And you
Mm.
can see in this picture that it clearly involves the line between the side of the nose and the angle of the mouth, the nasolabial fold. You can see that's clearly involving the line. One of the reason why these two can be confused is the fact that both conditions can be worsened by sun exposure. So
Mm.
that's the reason why, this got worse with sun exposure is a lupus. Yeah, but when you see a dermatologist, usually dermatologist can easily tell the difference between lupus rash and rosacea. So if you're worried, please see your dermatologist to get that evaluated properly.
Can I share the second slide?
Yes. So this is a different type of lupus. The previous lupus is called butterfly rash or Bella rash. This is called long word, subacute cutaneous lupus erythematosus. In short, I just call it subacute lupus rash. The below picture is discoid lupus rash, discoid lupus erythematosus. And they're a little bit different in that the subacute form usually look like linked, multiple, like a ring is linked together, usually on the chest, arms, and the back, and very highly photosensitive, so that when the patient get exposed to sunlight, this will get really crazy. So, but you can see the very distinct that it has this polycyclic appearance. And the below picture is a discoid rash, look like a coin. That's the name discoid means. And this one can appear as a multiple or by itself. And the Heidi Klum's ex-husband Seal, so he's kind of the most famous person who had disco lupus. The scar on his cheek, that's coming from discoid lupus. And if that happens on the scalp, it can cause a permanent scarring, hair loss, because the inflammation can destroy the hair follicles, so hair cannot grow anymore.
Okay. Thank you so much for providing this. This has been very helpful. All right. So next question is this. Can I prevent it? People ask, okay, are there things that I can do to minimize the risk of me having this? Can you touch on that, doctor?
Although there's no proven method to prevent lupus per se, like a prevent
Right.
medicine, anything like that. But there are things that we can avoid to prevent triggering the inflammation process. So
Okay.
lupus is inflammatory in nature. So
Right.
everything that can increase inflammation would not be good for preventing lupus. So by reducing these habits that can cause inflammation, we may be able to reduce the chance of getting lupus or chance of making the existing lupus worse. For
Okay.
example, mhm. So for example, things like smoking,
Okay.
excessive stress, not sleeping very well, eating a lot of processed food or junk food. So all of these are linked to increased inflammatory response in our body. So avoiding these things and keeping healthy lifestyle will be helpful, such as eating mostly whole food, plant-based diet, manage your stress, having good sleep, at least about 7 to 8 hours per day, regular time. So all of these healthy lifestyle will be good for preventing inflammation in our body. That's the reason why I specialize in lifestyle medicine, because I noticed that from my experience with my patients, uh, I I see over and over how these lifestyle habits are closely linked to their lupus disease activities. So
Mhm.
when patients change their lifestyle habit, I actually can see their kidney number gets better, inflammatory marker goes down, their protein in the urine gets better. So I actually see that in the laboratory results,
Mm.
just by changing the lifestyle, not even increasing the medication dose. So this way, patient can manage the disease without having to use excessive medication. Now, obviously, the patient has to take the medication, but we can use the minimal dose, um, because you are not adding inflammation to your body by having a bad lifestyle.
I love that. I
Mhm.
love that. And I didn't ask you to say it. An anti-inflammatory lifestyle would be good. So plant-based diet, managing stress, sleeping well, hydrating well. And of course, these are medical suggestions. Obviously, you should connect with your own doctor, your own rheumatologist, your own dermatologist and primary care doctor to come up with a customized plan for yourself. But there are things you could do to minimize the risk of having to use medications, because you can change it from the inside out. Awesome, doc. This is very, very good.
Yeah,
Um,
what I want to
Go ahead.
stress to that point is that some people think, oh, does it mean that I can cure lupus by just lifestyle modification? And that answer is no. Um, you still need to take the real medication, and this is more additional help that you can do.
Mm,
But I've been seeing some people, stopping medication, thinking that, oh, now I have plant-based diet, so I don't need to take medication. But that's not a good idea. You still need to take the medication, but keeping the healthy lifestyle will be able to, decrease the dose and maybe the number of pills. But
mhm.
there should be some maintenance medication to control this disease.
Okay, so it's a combined effort. Don't stop the medicines without consulting with your doctor. You work
Exactly. Consult
together.
your doctor first. And I want to kind of tell you about one thing because I just read a very interesting study.
Hmm.
So there was a study just came out about a few months ago from Harvard University. They showed that vitamin D and fish oil can, no, I would say may be able to prevent autoimmune disease in the future. I think it's a good idea to have a balanced diet because if we have balanced diet, we'll have enough this unsaturated healthy fat and the vitamin D from our diet and lifestyle. But if somebody needs some, for example, somebody have vitamin D deficiency, I think it will be helpful to make the level normalized. However, taking too much of vitamin D supplement is not advised because it can actually cause vitamin D toxicity. So I would say that you can consult with your physician and check your vitamin D and to see if it's low. And maybe if it's low, maybe you can consider that. But this is probably the first study that talked about how the nutrition may be able to prevent autoimmune disease in the future. So very interesting study, very well done study.
Thank you for sharing that. That's useful. Now, of course, these are medical suggestions. Check your levels. Talk with your doctor. These are ongoing research on this in regards to preventing lupus. Now, how do you test for it? Now, obviously, this is a very wide range question, but how do you as a specialist, how do you test for it if the patient comes to see you?
So usually the initial evaluation start with the primary care doctor. So usually when somebody has some rash, some joint pain, the blood test is abnormal, then the primary care doctor would order a test called ANA, which is the abbreviation of anti-nuclear antibody. And then that's the first study that we do to check for lupus. However, not everyone that has ANA has lupus because it can be seen up to 20 to 30% of normal people without having lupus. So we have to do a little bit more than just checking ANA. So the doctor will check some other tests such as blood count, kidney function, liver function, urine test to check if there's a protein in the urine. If the patient has certain symptoms such as chest pain, which can be seen in lupus patients, there may be a chest X-ray, ultrasound of the heart. So there will be uh, various tests according to what kind of symptoms the patient has. And the diagnosis is made with all these results considered together as long as with the patient's symptoms and physical exam. So if you have any symptom that you're worried about, if you have rash and joint pain, then you should talk to your primary care doctor and start the evaluation and maybe see a rheumatologist if your primary care doctor thinks that you should see a rheumatologist.
All right, very, very helpful. A lot of information that you loaded there, Doc. Not every positive ANA is lupus. Of course, see your primary care doctor, start the basic test, and then you can be referred out for further testing or further diagnostic test. And lifestyle changes can help. All right, so I wanted to emphasize that because the whole point of having these conversations is to help improve the quality and quantity of life of our patients, even with lupus. Thank you so much for coming. This has been good. Sarah joined us earlier, Dr. Sarah Merritt. Thank you so much for joining us. Now, people are wondering, they're saying, look, I like this doc. How can people connect with you? Maybe to come talk at an event to talk more about lupus or the autoimmune diseases. How can people connect with you, doc?
I have a website. It's just very simple. My name, www.celinemd.com, and you can find more about me on the website.
All right, awesome. And after this live is done, I will post that just to have people know where to connect with you. Thank you so much for coming. This has been very helpful. I've learned too just listening to this. So, and I hope people who watch this have found this useful as well. Please share with those who could find this useful. And as always, thank you for joining. And if you or anyone you know is looking for an awesome, a thorough, a passionate family physician here in the Texas area, I am she. Dr. Lee, thank you so much for coming. You rock.
Thank you. Bye bye.
Bye.